is that a child who is um, admitted in the hospital, probable diagnosis, it can be meningitis. For confirmation meningitis, we can do lumbar puncture. Now you have to take consent from the mother. Mother is Mira and the child is John. John is 8-year-old boy, about the lumbar puncture.
Okay.
When
Mother
you're
is
ready,
Meera
just,
and the son is John.
yeah.
Tell me when to start.
Okay, you can start. I'm ready.
Good morning.
Good morning.
I suppose this is Meera, John's mother.
Yes, I am Mira, John's mother.
Okay, I'm Dr. Nida, one of the child doctor working in this hospital, and I'm here to talk to you regarding John. Is that okay?
Yes, okay.
So I am here to take a consent for a procedure for John called lumbar puncture. Do you want anyone to attend this meeting?
No, no, John father is busy. He's just away from us. So you can tell me what's wrong with John.
Okay, so I'm here to take a consent regarding a procedure called lumbar puncture, and I would like to explain you regarding the procedure and the need of the procedure. And then in the end, I would like to ask to take the consent. Is that okay?
Okay.
So, as you are quite, what are your updates regarding John till now?
Yeah, John is admitted in the hospital. There is a brain bug. Now you are telling about the procedure. But what is lumbar puncture? Why you want to do that?
Yes, yes, I appreciate your concern. What happened is that actually John is having a infection in the brain, bug in the brain, and we need to find out exact bug what it is. So this is a procedure in which I'm drawing the picture. Okay, so this is our brain, and this is our cord which is going down. It is a part of the brain which is going down, and it is all protected by the spinal canal, like our backbone. Am I making myself clear?
Yeah, clear.
So, so what happened is that it runs a fluid around the brain which comes down also. The fluid is called the CSF or cerebrospinal fluid.
Hmm.
Is it clear?
Yeah, clear.
So the bug which is in this fluid, we need to find out the exact bug. So that's why we need to take a small amount of this fluid, and
Okay.
through this procedure we can draw a small amount of the fluid, and the procedure is done in under sleeping medicine, and it is I mean the John will not feel any pain. um, am I making myself clear?
Yeah, I have make it myself clear. But how long it will be take? Is that we can go home
Yes,
after the procedure?
yes, I was coming to these points. This procedure will hardly take like 30 minutes, and you will actually John is already on treatment for the infection in the brain, so he will be continuing with that medicine, and uh, the procedure, I can explain you how the procedure has been done. Is it okay?
Yeah, okay.
So the child is made to lie down in a position, in a flex position like this, which I am drawing, and then his backbone is open. So small after all the after cleaning all the areas, we pass a small needle into this space and then draw a small amount of fluid. Okay,
Okay.
and then we send this fluid to the laboratory so that we may know which kind of bug is that and for how long we have to give treatment for John.
Okay, I understand. So, every procedure has drawback. So what is the drawback of this, side effects? I want to know.
Yes, you are quite right that every procedure comes with a minimal risk of any drawbacks. But the drawbacks are very minimal of sleeping medicine, like some allergy, some breathing problem, and for the procedure itself, there may be some sort of infection on the site of the procedure, but we will ensure it by doing it in a very clean environment, to be done it with a very skillful person, so that these risk factors are all minimized. Are you with me?
I'm with you, but is that I have heard that it can be paralysis occur, doctor, if it is mistaken
Oh,
occur.
oh yes, but the risk of that is like very very minimal. And here in the drawing, you can see the space where we are going in. It has no part of the brain in it, no part of the spinal cord in it. It is away from that part, so the risk is very very minimal. Am I making
Oh,
myself clear?
is there any alternative?
No, I'm sorry to tell you, there is no alternate for this test.
Okay. So that day he will go home. How many days he need to stay in hospital?
So this will be decided by our consultant after the result of this test. So he may be the right answer to answer about the days of admission.
Okay.
So do you want me to summarize what we have talked till now?
Yeah.
So so John has been diagnosed with infection in the brain, and he has already started on the treatment, but we still need to know the type of the bug he's having. So we have the consultant have planned a procedure called lumbar puncture, for which he has to undergo a procedure, during which a small amount of the fluid from the brain will be taken out from the back of the body. It will be done under sleeping medicine so that he may not feel any pain, and it will be done with a proper cleaning technique and by a skillful doctor, so that he may not feel any pain and any bug infection. So now, can I take the consent for this procedure, Mira?
No, no, no. I'm not interested. I have to wait. I have to think about that.
Okay, that's okay. That's your right. But you see, we have to perform this procedure as soon as possible. So take some time, and then I'll again get back to you.
Okay.
How much time?
Time 1 minute maybe remain, but we have to give trusted website leaflet.
Oh, I forgot that. And also, I didn't tell about headache.
So if still refuse, we will arrange a meeting with the consultant at the end. Okay.
Yes, yes, yes.
Another thing, at the beginning, what happened? I have not asked you how can do the procedure. You have to give me the time. How can you do the procedure? Already giving the anti-gap treatment. Why you want to do that? Okay. You need to take a pause. But at the end time, you have given me chance to ask questions. Then I ask one by one paralysis about the drawbacks, about alternative. Okay. Beginning, we have not given me chance. I think with stress, you are going smoothly. And another, you tell the procedure time flexed him. Flexed, I think jargon. You have to tell he will be he will be lie on his side and carved back.
Okay, okay.
Then we will
Yes,
insert a
yes.
small needle between the two bones in the lower back. And why paralysis? The doctor answered that answer is that you will draw a picture. I can imagine how is this caring for you, but we are using very small needle and we take the sample from this side, number 4 and 5. We will show this on the picture. And this is very rare. While the nerves end at the number 2, and this is very rare, may become any hematoma. Okay.
Hmm. Yes,
Okay. So can I practice?
yes, yes.
Okay, then I can practice. Tell me.
Okay, go on.
Hello, good afternoon.
Good afternoon.
I'm Dr. Sultana, one of the children doctor in this hospital. I believe I'm talking with Johnson, Mira, mother of Julie.
Yes, I'm Mira.
So, ma'am, thank you very much for coming here today. Today, I'm here to talk about. We have a new plan about management of Julie. And before I start, do you want anyone to join this meeting?
No, no, I'm here.
Okay. So, it's a suitable time to discuss in these topics.
Yes, yes, definitely.
Okay. So, ma'am, what is your update about Julie?
Yeah, so like she has got infection in the brain, and doctors have told me that fortunately they have picked the pick that she's having infection, and they have started the treatment, and now they want to do some procedure. I don't know, the treatment has been started, and now they are asking me that we have to do procedure. I don't know. So that's why I've come here. That I wanted to know that if you have started treatment and you are saying that it's fortunate that we have picked it early on time, on timely basis, then why you need to do another procedure?
Yeah, ma'am, you're completely right. Actually, you have taken a decision. So, we want to do a procedure that's called lumbar puncture to identify the reason, exact cause of the bug. For that reason, I'm here, and I hope that at the end of this meeting, I can take your consent about this. So, ma'am, how much you know about lumbar puncture?
I don't know much about that. I just know that it's something to some painful procedure. I don't know exactly about that.
Yeah, ma'am, I understand your stress. I'm easily explaining you. Let's see how can we do that. First of all, Julie can be sleep on his side, on her side, and carving the back. We just put a small needle between her two backbone, and in turn we collect some fluid that we called CSF, cerebrospinal fluid, and we'll know that by this that what is the cause behind this bug, which is actually determine the staying in the hospital and exact cause for that. And also, I want to tell you about pain. Actually, ma'am, we will do before doing that, we'll apply a numbness cream. The area will be fully numb, so Julie will not that much feel. And also, very small needle will introduce with that. Am I clear so far, ma'am?
Okay, yes.
So this is all about lumbar puncture. Uh, okay. So, ma'am, I want to tell you about some drawbacks. Lots of
Yes,
drawbacks.
yes,
Every
definitely. Yeah.
procedure has drawbacks. So, this lumbar puncture has drawbacks, but it will be done by the very much expert hand who has done before to lots of time this procedure, and sometimes infection. But we are doing it on clean environment, very much hygienic. Number one, number two, pain. We are giving numbness cream, also painkiller. Headache can be occur, but she will take lots of fluid after that. She will take rest and catching bug pain for bleeding. If bleeding occurs, it's be very minimal, and if it's occur bleeding, we'll manage it. Okay, ma'am.
Okay.
Okay. So, have you
Okay.
any other concern?
Yeah, you said for pain you will be giving, for bleeding you will be giving. Any other thing which can happen to my child? Like I've heard sometime that it can cause even paralysis.
Ma'am, I understand you are really scary about this matter. I drew the picture. I'm showing you. Actually, we are collecting the fluid from this level that calls number lumbar vertebra backbone, that is 5 and 6. Okay, this level bone, where the nerve of our brain end at the level 2 level. So it's really very rare to affect this or making any hematoma with that. Is that clear, ma'am?
Yes, yes. Okay.
Okay, okay. So have you any other concern?
Yeah, can we go with the treatment without doing this procedure? Then we continue?
Actually, ma'am, there is no any alternate of this procedure, but it's really we need to know that what is behind this brain bug. It's really identify cause because it will determine her staying in the hospitals. Number one, number two, if the brain bug is caused by any viral cause, so unnecessary she's taking the medicine. So we need to know what is behind, and it's really needed. Okay, ma'am.
Okay.
So,
Okay,
ma'am,
that's fine.
okay. So, ma'am, is that you are agree with our plan of lumbar puncture?
Yeah, I'm just waiting for my husband to come. So I want him to give him consent. He will he will he is a person to take this decision, the final decision.
Okay, ma'am. So it's really urgent. We need to do it as soon as possible. Hopefully, you will give the permission as soon as possible. Okay.
Okay. Okay.
Okay. So, ma'am, today we have discussed a lot. So, can I summarize what we discussed for better
Yes,
outcome?
yes. Yes.
So, ma'am, today I'm discussing that a new plan we add in our management of Julie's brain bug, that is lumbar puncture procedure. I already draw a picture and told you how can we do that, and the drawbacks, benefit, and everything I already discussed you. Okay.
Okay.
And ma'am, I'm giving you some trusted website and leaflets about this matter. Then it will be much more helpful, and you will know much more about this matter. How does that sound?
That sounds better.
So, ma'am, thank you very much for your time, and wishing Julie soon very healthy. She will be come back to us. Okay.
Okay. Thank you.
And you have any questions about any matter, any doubt, you can ask me. I'm here to
Okay.
answer you. Okay.
Okay.
I think 10 to 30 seconds remain. So, how is
Uh,
that?
th- no, no, that was fine. You address all the concerns of the mother and sleep and you you mentioned about the headache.
Yeah, I headache, fluid
Yes,
take,
yes, needle.
rest. I
Yeah,
told you.
yeah, yeah. To,
For headache, we'll do usually mild and we'll give
yes, yes.
painkiller, fluid, and lying
Yeah.
flat.
Okay, tell me, is it done in the sleeping medicine or a numbness cream?
Numbness. We numb the area with local medicine. We'll give him medicine, making him relax. So in hospital, we are doing now. We are not doing by sleeping medicine. We just numb the area, right?
Okay, okay. Yes.
Okay. Then so your task